Guru Nation, welcome to episode 147 of Random Musings from the Clinical Trials Guru. Yes, we are on episode 147. We are getting on our way to 200 very soon. Got questions today. I've been busy. I'm going to be going to a LinkedIn event tomorrow, Thursday, May 10th in LA. Nothing to do with clinical research, but there's a lot of healthcare people that are going to be there. There's also a lot of social media people that are going to be there, self-promoters. It'll be interesting. I'm trying to build my brand as far as my digital marketing company is going, and I got the opportunity to be on a panel for LinkedIn and how to integrate podcasting and social media and all that. I'm going to have a videographer, and they'll be documenting that. A lot of it will be for dansfera.com, which is my digital marketing website. But there's going to be a lot of healthcare people there, so I'm going to probably get to meet some doctors. I don't know. Maybe I might talk to them about clinical research. Of course, I'm going to talk to them about clinical research. So there's always an opportunity. Just like I tell you all, never stop searching for new doctors to add to your database. And some of these doctors are local here in LA. And the ones that are not, we can set up their sites for them wherever they are. Okay, so that'll be fun. I encourage everyone to network when you can. Social media is great, but there's nothing that replaces face-to-face, hand-to-hand, shaking hands, meetups, and all that. The problem is, especially in clinical research, those things are expensive. Those things have become circuses, I guess. What's the plural for circus? And the travel is just, usually they're on the East Coast. So for me in California, and I understand why, and now that I'm planning my own conference next year, it's going to be probably in Orlando in May 2019, the Guru Conference. Check that out on my website. Would love to have you there. Message me if you're interested in attending, speaking, presenting, being an exhibitor. But I understand why they're done on the East Coast. But I do try to go out to at least one or two clinical research conferences every year. If I could, I would go to more, but a lot of them have kind of lost their value. They've gotten too big, like Bio, which I went to last year because it was in San Diego. It's just way too big. It's good if you know people from, your contacts on LinkedIn, and you could plan meetups there. Like, I got to meet a lot of people that I never met before at this conference. But if you're just going to sit through keynotes and stuff, you're probably better off just watching YouTube videos. But if you're going to network, and if you're going as a site owner or as a CRA or as just anyone in the industry that wants to network, those are good opportunities to do that. But then conferences only go on once a year per conference, right? Some go twice a year, like Magi, which I have yet to go to. Some go twice a year. But what do you do in between those conferences? Like, that should not be the only time you network. You should extend your networking, continue the conversation on LinkedIn whenever possible. Almost everyone in this industry is on LinkedIn. So that's going off on a huge tangent, but I'm going to be going to a LinkedIn event tomorrow. And then Friday, I'm going to be in LA all day, working on meeting with sponsors. Friday, I'm actually meeting with a device manufacturer that wants to get into studies. They're working on exciting things. A lot of innovations coming out this year, and they've been coming out, but this year we're starting to see a lot of that. So I'm approaching them through my CRO. And of course, my CRO comes with a network of sites and all of our clients that we have too, and then the entire infrastructure that we built through the academy. So I'm meeting with a sponsor Friday, and then I'm also meeting with another client on Friday who's in LA, and then another client. So actually Friday's going to be busy, all in LA. So I'm not going to be back here. This is why I'm doing a podcast today, because I'm not going to be back here. And tomorrow I'm going to be at an event. I'm going to try to get some podcasts done, but you know how it is in these conferences. You can't always guarantee you're going to have a quiet place to do one of these interviews. So might as well get one out of the way now, but this is going to be a good one. So Speaking of LinkedIn, I got a message from someone. Um, and by the way, anyone can reach me on LinkedIn. I love LinkedIn. I think it used to be boring, and now it's starting to get kind of lively. So there, I opened myself up. You actually have a profile on LinkedIn. You have an option on your profile to open yourself up as someone who gives career advice. And, I was just looking through my LinkedIn yesterday to kind of go over some of the nuances of LinkedIn before this conference, since I'm talking about LinkedIn. I mean, all I do on LinkedIn is upload videos, upload articles, and then occasionally comment on people's stuff and respond to messages. But I noticed there's this career advice section on your dashboard, and you can turn it on. And there's also a career interest thing on your dashboard, which I turned on because I'm going to get opportunities. I'm going to say no to 99.9% of them, send them to my students. But every now and then I can find a good contract CRA position, which somehow I still have time for if they are very part-time, meaning 2 site visits every 6 weeks max, 2 site visits every 8 weeks max. So I turn that on. Make sure you go turn on your career interests button on your LinkedIn dashboard and your career advice. If you have that, I don't know if it's open to everyone, but it's on mine, and I don't know anything about it other than I turned it on, and then people started messaging me. So it's actually good for me because I could kind of give people advice and maybe help them out through my CRA Academy, my Site Owner Academy, or just give them advice, period. So one person keeps applying. He's a foreign doctor, and he has a dream of going to residency in 3 years. And so now he's a coordinator. He's a part-time coordinator. He has like a year of experience as a CRA, but that CRA closed. So then he had to downgrade his career to a coordinator to get hired quickly. Although I still think this person can be a CRA because he has a year of experience. But where he's going wrong is, again, he's a foreign doctor. He's articulate. His CV looks good. But in his interviews, he keeps telling the interviewer that in 3 years he's going to go to residency. So, first of all, you have a year of experience as a CRA. You're pretty much entry level. Now you're telling an employer, and your CV looks good, so you're getting interviews. You're never getting a second interview because, according to this person, he keeps bringing up the fact, and it was actually written right on his CV, he plans to go to residency. And he doesn't even know if that's actually going to happen. Residency is extremely difficult for foreign grads to get into. I mean, that's not a guarantee that you're going to do it. Right now, it's just a dream. He even admit that this is just a dream. So my question to him was, why are you even bringing this up at all in your interviews? These interviewers don't care about your dreams. They don't care. That'll be the title of this podcast. Your employer, they're not even your employer yet. Your interviewer, the person interviewing you, does not give a damn about your dreams. Okay? Only you should give a damn about your dreams. Small businesses their employers tend to give a damn about people's dreams. For my employees, I found a good strategy that works to keep them around longer and then to benefit myself later, is to figure out what their dreams are. Like, what do you want to accomplish in this industry? Let me see if I could help you. Just be completely transparent with me. If you want to open up another clinic and compete with me, that's fine. It's much tougher than you think, but it's usually never that extreme. Usually it's something like, hey, I want to be a consultant, or I want to be a CRA and I'm hiring a coordinator, or I want to own my own CRO one day. So my goal as an employer is to figure out what my employees want, which is tough because you got to build the credibility and trust with these people before they can be honest with you. But at these bigger organizations, they could care less. Okay, I mean, small business is different. The larger the organization, the less they care about your dreams and your ambitions, regardless of how many HR people they put in between you and your manager, however many HR people you can talk to. They don't care. They care about efficiency. They care that if you're a CRA, they care that you can SDV. They care how much time you can go on site. They care how much you can work. They don't care that you have an idea to go to residency in 3 years, because they're going to interview you. You're pretty much entry level, and they're going to waste all this time and training into you. It takes about 2 years for a CRA to really get good at what they're doing, like to get competent at what they're doing. So you already have 1 year. Okay, now they're going to have to invest another year into your training. They're not just going to throw you out to sites initially anyway. So they're investing time and money into you. And then in another year, you're going to leave for residency. Like, nobody wants to hear that. No employer wants to hear that. Maybe at a research site, it's a little different. Okay, there's still a learning curve for a coordinator, but I could bring you in as a research assistant. Then you can become a coordinator. You're a foreign doctor, so you've got an understanding of the science and the medicine and side effects and all that. You're not a PI, you're not a sub-I, but you still have an understanding of what's going on, so there's less of a learning curve. So I can take that risk, right, because I'm not investing that much time into training you. Although even at a site, okay, especially a big site, if they're going to hire you, they want to keep you long term, especially with CROs. They want to keep you long term. They don't want to hear that you're going to be going to residency in 3 years. So my advice to this person: tweak your resume, take that nonsense off about your dreams. Hate to break it to you, nobody cares. And you've got to just be a CRA, okay? And when residency time comes, that's when you can make that decision. Don't think about that now. Obviously, I'm not telling you not to go after your dreams, but I'm telling you to get very practical about your career, right? Because what if you don't get that residency and then you never get a CRA job because you keep saying the same thing? So that is my advice to this person. I got another question from somebody today, actually, who wants to be a study broker. So they actually, I don't even know what they do. I think they run a site somewhere. And they were calling me. I thought they were trying to get advice from me, but they were trying to sell me on me using them as a broker. And I said, look, I don't believe in brokers. We do some brokerage services for research naive clients only, and we tell them you're paying a lot more doing this than just paying us our monthly retainer fee, but they still want to do it. So we only do it for research naive sites. We only do like a handful of sites a year as a broker option. I don't like brokers, but I'd rather they work with me than someone else. This person wants to be a broker, was asking me if I could provide a template of a contract, was asking me how to do it. He didn't seem to understand research. And there's no way, this is another macro concept I'm going to talk about. If you're going to sell something to someone, you have to know more than the person you're selling it to, right? Like, this person was trying to sell me broker services. First of all, I don't need it. Second of all, he was asking me how to do it. And then I gave him some advice, and then he tried to sell me on it. So that doesn't work that way, okay? Your best bet is going for the research naive people, just like we're doing, and figuring out a way to be fair to them. And what's fair, I don't know. I mean, 5%, 10%, 20%. I've heard some brokers doing 50%, which is ridiculous. They're taking advantage of these research naive sites. We try to get all our research naive sites that are on the broker option with us to eventually become clients. But that's not how the other brokers operate. And there's so many brokers out there. Most of them don't have good reputations. So the macro concept here, and there's a lot of people in this industry in clinical research that are trying to sell services to other people, and they don't know very much about what they're doing. I mean, that's fine to sell something. You only need to know more than a person willing to pay for it. But when you don't know more than a person willing to pay for it, or you know the same as someone you're trying to sell something to, it's not going to work. Okay. And at this level, the way this guy was talking, he's not going to have a huge target customer base. I mean, he's pretty much research naive himself. So that's not going to work. I know a lot of people they're trying to do this with contracts and budgets. There's an arbitrage that you can play there. It's just, it's not something you could build a foundation on. There's nothing that occurs easy here. Just because you know how to get studies doesn't mean you can be a study broker. Okay. Or maybe it does, but in this guy's case, it definitely didn't. You've got to understand contracts. You've got to understand how sites get paid. You've got to understand how you get paid. What kind of contract are you going to have? Some brokers are super shady, and they will charge the site a percentage of the entire study budget. Whether or not the site recruits patients is not their concern. I've lost money on brokers twice. I think it was three times, actually 3 protocols, back to back to back. Same broker. One study I didn't enroll anyone. I owed the broker $8,000. Another study I enrolled like 4 people. I owed the broker $10,000. I can't remember. This was like 2007, 2008. So you can lose money working with brokers. So be very careful if you're a research clinic doing that. Finally, I wanted to talk to you about, I got a question today from a site owner, and they have to take over the operations from another partner who left, just took off. And this happens so often. I mean, that's another lesson. Be careful about who you partner with, who you get into business with, because it really, I know it's a cliche, but it's like a marriage, right? You're stuck with this person if you get in business with someone as a business partner until that company dies or dissolves, or you guys come to an agreement on how to separate, right? It's a marriage. And if you want it to be successful, you got to work together, and you got to be comfortable working together. So this person, basically the partner left, which happens a lot, by the way. Happened to me a few times in my career. I've been doing this for a little over a decade. It's happened that I can recall to me directly 5 times. 5 times. Sometimes it was a PI that was a partner that left. Other times it was just a business partner. 5 times. Okay. So that's not like just once every 10 years. I've been doing this 12 years, so it's almost once every other year. And that's a lot. You got to be prepared for this. So I advise you, if you can, my advice to anyone that's going to start a research site is to try to do it on your own. If you need a PI, let's say you're not a doctor, I would start off with your PI as a contractor first. After 2 years, at least, give it a minimum of 2 years. If you like the person, if they like you, if they like research, if they have oversight, if they're not being unreasonable, if they're pleasant and you feel like you can make money together, then I would offer ownership. And by that point, that PI is probably gonna have brought it up to you because they kind of maybe figure out the business themselves. So your job is to let them know that you're making their life easy, because doctors, they don't necessarily, especially doctors that have a private practice and are busy with hospitals and all that other stuff. Like, research is a great way for doctors to have an additional revenue stream without really increasing their workload too much. That's like the biggest secret in all of healthcare is, yes, you got to have PI oversight. Yes, you got all this and that. Like, research is serious business. But at the end of the day, there's an entire industry that is built to support PIs so that they don't have to work on the research business 40 hours a week. As a matter of fact, if you build your company right, your research clinic, you want your doctor spending more time with their private practice because they're growing their private practice. That's going to help you get more studies and get more patients in your studies. So if your doctor's getting antsy about, wanting to be an owner, again, 1 to 2 years, I would say 2 years to be conservative, but you can go 1 year. 1 year, then you offer them ownership if you're comfortable with them. All the stuff I mentioned, right? If they get antsy prior to that, it's your job to remind them. I did a rant yesterday on YouTube. Anything that goes wrong in your business is your responsibility and it's your fault. If your PI gets antsy about not having ownership, that's your fault. You're not communicating. You're not setting their expectations properly as far as how much income they can make. And the first year is the toughest year. That's the one where I say your PI is most likely going to leave you. Your first PI is most likely going to leave you within 1 year if they're research naive and you're research naive. I've seen it happen more times than it hasn't. So if your PI is getting antsy, it's your fault. You got to communicate. My suggestion is over communicate with them. Okay? I don't practice what I preach, by the way. I don't do that. We have people now at each of the clinics that are supposed to fill those roles. But as the owner, ultimately it's my responsibility. So if those people are not doing their jobs, then it's my fault. So if the PI gets antsy, the PI wants to leave, the PI doesn't understand how they get paid and why they haven't got paid and they've been doing a PI work for 8 months, you need to tell them. And then you need to tell them what value you're bringing to the table. Say, hey, look, as a coordinator or as a CRA that owns this clinic, I'm basically reducing your workload so you can have the benefits of doing research. You can give your patients an alternative to their treatment. You can make extra money. It looks prestigious on your resume. You can talk to medical liaisons about research. You can eventually get into investigator-initiated grants, which, by the way, took me an entire decade to figure out, but now we're getting into. I'm working on 2 investigator-initiated studies, and I'm working on a proposal for a 3rd right now. That's all exciting stuff for doctors, and it's your job to sell them on this idea that if we do it right and you let me run the business, the research business, you just keep growing your private practice, you maintain oversight, safety oversight over the studies, you meet with the monitors, I'll do everything else to keep this business afloat and going well and growing for you and then bringing you more opportunities. So that's what I would do in this person's case. And by the way, I don't know if their business partner was a PI. I think it was a PI that left. So, and I don't know the logistics. I think they were an owner already. So I'm guessing this person just got into a quick partnership agreement with someone they barely knew and oversold them on research. Hey, you can make millions of dollars in your first year and you don't need to do anything. And that's not the case. That's the furthest thing from the truth. And this PI probably left, but I'm speculating, this is an educated guess. One more question. I'm a foreign MD, not licensed in the U.S. So this is the first topic I brought up. Working as a CRA. Oh, this person's already working as a CRA with a sponsor. Directly for a sponsor, very good. For a year. I do really want to become a medical monitor, but not quite sure if I need to be fully licensed in order to be a medical monitor. I started in this industry when I became a study coordinator, 2 years, and then worked different protocols with a urologist. One of the sponsors was very happy with my potential and hired me as a CRA. I do really want growth in this field. I'm planning to get CCRP certification, or I think it's ACRP is what they're referring to. So it doesn't hurt to ask, but a non-U.S. licensed medical monitor is very unlikely to happen. I have never seen it on any industry-sponsored study that I've worked on in 13 years of doing this. Maybe you can be like a co-medical monitor on an investigator-initiated study, but there's no real practical value for you to do that. Those investigator-initiated studies don't really make that much money. It's pretty much like you're doing it at cost. So unfortunately, I don't think you can be a medical monitor. It doesn't hurt to ask. If you don't like CRA work anymore, you can try to, and again, this relates to the first topic I had, or the first question. Like, these people don't care about your dreams. Like, yeah, you want to be a medical monitor. The reality is you're a CRA, and you're much more valuable to them as a CRA than a medical monitor, which you're not even qualified to be because you're not licensed in the United States. So what I would do, if you're comfortable, approach them about what other opportunities you have besides CRA. And don't, you've been working there for a year, so they're not going to get rid of you just because you're asking them. I mean, if you brought this up at an interview, you wouldn't get hired. At least I don't think so. But now that you've been there for a year and you're a good employee, I really think that you can take a stab at it and ask them what other positions you can get into, maybe pharmacovigilance. And, I don't know the context of why you don't want to be a CRA. I'm assuming because it's stressful and you got to travel. So maybe something like a project manager where you don't have to do that, or just suck it up and work another 5 years and then become a lead CRA. Maybe it could take 7 years to be a lead CRA, or become an in-house CRA. Maybe, like, I don't know why you don't want to be a CRA, but there's other jobs besides medical monitor. And medical monitor sounds cool because they don't really do anything, and which is not true, but compared to a CRA, they don't do much. But I don't think you're going to be a medical monitor in this country. You could be a medical monitor in the country you came from, but I don't know what the clinical research industry looks like in that country. So hopefully that helps. That's all for today. Episode 147 was a good one. I'm going to title it "Nobody Cares About Your Dreams in Clinical Research," and hopefully you got something out of it, something for the CRAs, the wannabe CRAs, the wannabe medical monitors, the wannabe site owners, the existing site owners. Hopefully there's something here for everyone. Catch you all later, and thank you for supporting. Really means a lot, and we'll talk soon. Bye-bye.